Dr. Matt Sherwood with Northwest Indiana Chiropractic. Today I was going to do a video on something else, and then in the past 2 or 3 days I've had like 3 or 4 patients come in with the same exact complaint, and I thought I would discuss how, and try to explain I guess, the difference between pain that's actually coming from the hip itself and pain that is referred to the hip from the lower back. So the most common complaint I get with this, when people come in, they'll say, yeah, I think I pulled a muscle in my glute or my butt. They usually say right here, okay? So obviously that can actually be a muscle that's strained in your hip, all right? So an easy way to kind of tell that would be, is it sore when I push on it, okay? So if you put pressure on there, is it sore locally? That's one indicator. It could be from a muscle in the hip. Another indicator, sit and try to stretch the muscle and see if that reproduces the pain, okay? So you can cross the leg like this, which will kind of place these in a stretch position, lean forward, the leg, similar stances you can lay on your back, bend the knee, pull that up, see if that reproduces the pain as well, okay? That's another one you can do. The other possibility, as I mentioned before, is that the pain, the tightness in here is actually coming from the back in the form of a pinched nerve. So what can happen is you can get a disc injury or a disc bulge, and that bulge will place pressure on the nerve, and the nerve will not slide properly. So in order to function, when we bend, lift our leg, reach up, our nerves have to be able to slide through the spinal canal back and forth, or we'd be walking tin men, essentially, okay? So all those nerves in your whole body, sciatic nerve, median nerve at the carpal tunnel, whatever, they need to be able to slide. So what we can do is try to test the sliding ability of that nerve and see if that reproduces our pain, okay? So the first thing we can do is we can simply bend forward like this. Now, if this were purely a hip strain or a strain in the butt muscle, bending forward shouldn't cause the pain to increase or reproduce the pain. There are exceptions to the rule, obviously, but generally, if you bend forward and you feel it pull here, that's not a good sign. The second thing we can do to test the nerve is we can sit like this, and we can slouch, and then we can straighten this leg out. If that reproduces our pain in the butt, that's a very good chance that that is a pain that's coming from a nerve that is not sliding properly. So that's how this is a position called a slump test. And what that does is it pulls the nervous system up toward the head, and then we pull the nerve down toward the foot. So we're taking the nerve and pulling it like this. If there's any tension on that nerve, it'll definitely reproduce the symptoms. If that is positive, and you bend down like this, and that reproduces the pain, more often than not, that's coming from your low back and the nerve is not sliding. And obviously that can be a big problem. So there's a completely different treatment if that's the scenario, as compared to if it's just a local muscle strain in that hip. So if in the future you get that feeling of tightness in the glute or hamstring for that matter, try those couple things. If it reproduces the pain and indicating it might come from the low back, that's something you need to get treated immediately, because that can be the sign of a worsening disc problem, a nerve that's pinched for some other reason. I had a patient that was their only symptom they had. They came in, no back pain, nothing, just felt like they had a pulled muscle in their glute. I suspected it was a disc. We did some exercises. They weren't completely compliant with the exercises. Well, I can actually bust them out. That was my brother. So he didn't really comply with the exercises. About 2 weeks later, he was in the emergency room with a huge, massive herniated disc. The only sign he had was tightness in his glute. So if you have that experience here, in the hip, even the hamstring to some extent, then you should come in, get that checked out immediately so we can catch that, treat it, and prevent it from becoming a worse issue. Thank you very much.